Good afternoon, everyone. As you can see, I'm joined by the Chief Medical Officer today, and he will take questions with me shortly. Before that, though, I want to reflect on our current COVID situation, and in doing that, I will also look ahead briefly to the statement I will make to Parliament next week. But before any of that, I'll summarise today's statistics. Yesterday, there were 2,802 positive cases reported, which is 8% of all the tests that were carried out, and the total number of confirmed cases now stands at 306,449. There are 401 people who are currently in hospital. That is 14 more than yesterday. And 38 people are receiving intensive care, and that is 4 more than yesterday. Sadly, 4 further deaths were reported over the past 24 hours, and that takes the total number of deaths registered under this daily definition to 7,744. And as always, I want to convey my thoughts and condolences to everyone who has been bereaved over the course of this pandemic. I'll also briefly update on the progress of the vaccination programme. As of this morning, 3,900,864 people had received a first dose of vaccine. That is an increase of 10,688 since yesterday. In addition to that, yesterday, 16,984 people got the second dose, and that brings the total number of second doses to 2,825,886. So as you can see from these numbers, the vaccine programme continues to make really good progress, and that should make us optimistic. For now, though, that optimism needs to be balanced by concern at the high case numbers we've seen recently, a pattern that is increasingly evident in other countries as well. However, on the upside, and while there will always be daily fluctuations as we can see, and that's why we look most closely at 7-day averages, but looking at the figures reported over the past few days, we can see the suggestion that the recent surge in cases may be to some extent levelling off now. Today's reported figure, for example, represents 1,432 fewer cases than were reported on this day last week. And similarly, if we look at the 7-day average, there does appear to be a slowdown in the rise in positive cases. So while we need to monitor this in the days to come, that is encouraging news, but obviously case numbers remain high, and that is a worry. We increasingly hear talk just now of learning to live with the virus, which we all want to be able to do. And it is true, absolutely true, that we can't live a restricted way of life forever, because that in itself affects our health and well-being. And it's also true, thankfully, that vaccines are offering us an alternative way forward. However, that desire to just live with it cannot mean that we simply throw all caution to the wind and no longer worry at all about rising levels of infection. And I want to just set out briefly why we can't simply throw all caution to the wind. Firstly, this virus is still potentially dangerous. As we see almost every day just now, it is still taking lives, though mercifully, thanks to the vaccines, it is doing so in far fewer numbers than we saw in earlier stages. Secondly, even although the majority, quite significant majority of cases are now in younger people who are much less likely to become acutely ill, the health impacts can still be significant. Many young people are suffering from long COVID, which of course experts still don't fully understand. So it would be wrong and irresponsible, because our young people are not guinea pigs, to have no concern at all about young people being infected with this virus. And thirdly, even although far fewer people with COVID are ending up in hospital now, around 3% of all cases compared to 13% earlier in the year, and that's mainly because vaccines are giving protection to those that previously were most likely to fall seriously ill, it is still the case that 3% of a high number of positive cases will still put significant pressure on our NHS. That's a matter of basic arithmetic. And because the NHS is much busier again with non-COVID care, which is a good thing because we're trying to catch up on the backlog created earlier in the pandemic when we had to stop a lot of non-COVID care, that pressure will be felt now much more quickly. And it is already being felt in our NHS. Already some hospitals are having to scale back a bit on COVID elective care again. And I just want to take the opportunity again today to pay tribute to everybody working really hard in our NHS up and down the country. So for all of these reasons, while it is still the case, and this bit hasn't changed, vaccines are offering us the way out of this, hopefully soon, this is a moment for care and caution. And that's not true just here in Scotland, although we are undoubtedly at the sharp end of this Delta curve. But increasingly we see and hear other countries faced with an accelerating Delta wave also re-emphasise the need for caution. And it is worth pointing out, and I'm doing this non-pejoratively, just as a statement of fact, and because the pressure is always there for Scotland to follow suit, I think it is worth pointing out that the path the UK government is embarking on for England, which is entirely a matter for them, a path of not just lifting all restrictions from the 19th of July, but also removing the requirement for basic mitigations like face masks, and doing so against the backdrop of sharply increasing case numbers, is something of an exception. So while I totally understand the desire that some have for us to follow suit in every single respect, we have to think carefully about the steps we do take at this juncture. My job is not to take the easy decisions in a quest for popularity. It's to do what I think is most likely to keep the country as safe as possible as we get to the end of the vaccination programme. You've heard me use the analogy before, and I'm far from the only person to have used it, that this is a race between the virus and the vaccines. And over the next few weeks, as we complete the vaccination programme, it is really important that we don't let the virus outrun us. So that brings me on to the second issue I want to just briefly cover today, which is the statement I will make to Parliament next Tuesday. As you know, when we published our revised strategic framework, we said that the 19th of July was the indicative date for Scotland's move to level 0. Next Tuesday, ahead of that date, I will set out to Parliament the final decision that the Cabinet will reach on Tuesday morning on whether and to what extent that move is able to proceed. Now, it's worth noting, and again, just as a statement of fact, not because I want you to read anything particular into this, that these decisions needn't always be binary. It is always possible to proceed with some planned changes, but hold back on others if we think that is appropriate. Obviously, though, I very much hope that we will be able to move ahead as planned, and the apparent slowing down in the case numbers gives me more cause for optimism about that than I might have had a week ago. But nevertheless, between now and Tuesday, we will continue to monitor very carefully the latest data on cases, but also on hospitalisations and deaths to see whether that weakening of the link between cases and severe illness is continuing. So that is a decision I will set out on Tuesday, and I don't want to preempt that decision any further today, but there is one point I do want to emphasise, particularly given that I'm very aware that the media will be full of talk of so-called Freedom Day in relation to England. And I absolutely understand everybody's desire to get to what is called Freedom Day here as quickly as possible. But as the case numbers show, COVID is still with us. It is still present across the globe, and it's going to be around for some time to come. So it is important, I think, just to remind all of us that a move to level 0 doesn't mean the immediate end of all restrictions. Many of the baseline measures we use, things like face coverings, physical distancing, rigorous hand hygiene, advising on good ventilation, these are going to continue to be important mitigations in protecting ourselves and others from the virus, perhaps for some time yet. So no matter what our decision is next week about the move to level 0, there won't be an abrupt end to these basic protective measures when we do move to level 0. And obviously I'll set out more about that in the statement I make next week. To finish though, I want to remind everyone of the 3 things all of us can do to help beat this virus. We hopefully are seeing a slowdown in the rate of increase that we've had in the last couple of weeks. That's good news. The vaccination programme continues to go well. We have got drop-in clinics in every part of mainland Scotland to encourage people to come forward for vaccination. So we have cause and reason to continue to be optimistic. But this is a moment in our path out of this pandemic for us to be careful and cautious. And all of us have a part to play. And I just want to end by reiterating the things that all of us can do to help and to help get us back to that position of normality as quickly as possible. The first is to get vaccinated as soon as you're invited to do so. If you're over 18 years of age, you should have had your invitation for the first jab by now. So if you haven't had that, you can self-register on the NHS Inform website to get an appointment, or you can go to one of the drop-in clinics. As I said a moment ago, there are open clinics in all mainland health board areas, and you can find details of the one nearest to you on the NHS Inform website or on the social media accounts of your own health board. These drop-in clinics are also available to anyone who's had a first dose 8 weeks or more ago but hasn't yet had the second dose. I simply can't emphasise enough just how important it is that we all get vaccinated with both doses. So please get both JAGs as soon as you can, and the NHS Inform website is a place to go if you need information on how to get your JAG. Second thing we're asking everyone to do is to take the opportunity to test yourself regularly. That's particularly important if you're planning to visit somebody or go somewhere. If you take a test before you go, you will reduce the risk of you inadvertently spreading the virus if you perhaps have it and don't have symptoms. So it helps protect those that you'll be coming into contact with. You can get lateral flow tests, again, through the NHS Inform website. That way you can get them sent to you by post, but you can also pick them up from local and regional test centres or from local pharmacies. If you test positive through one of these lateral flow devices, or if you have symptoms of the virus, please make sure that you self-isolate and that you book a PCR test as quickly as possible. And if you are identified as a close contact of someone with COVID, you will be asked to self-isolate for 10 days, so please do that. We are reviewing the policy on isolation for contacts of positive cases for the future, and we'll set out our intentions on that shortly, but for now it remains an important mitigation. And the third and final thing we're asking people to do is stick to the rules wherever you live and keep following the basic hygiene measures. Meet other people outdoors as much as possible. If you are meeting indoors, stick to the limits on group sizes, follow the advice around hygiene and ventilation, and remember that is important even if you're meeting indoors to watch the football or other sport. And please remember physical distancing, hand washing, face coverings, all of these basic mitigations still help us to limit the spread of this virus. And if, like I'm sure most of us have been over the past few weeks, you've been slipping on these things, this is a moment to tighten up again as we hopefully embark on this next phase and final phase of getting out of the COVID restrictions. So these are the key things we're asking everybody to do. We're all thoroughly sick of every single aspect of this. I don't just know that, I feel that. But it is really important that having come so far and having hopefully an effective end point to this in sight, that we stick with it to make sure not just that we get to that end point, but that we're getting to that end point as safely as possible. So thank you for your continued patience, thank you for your continued forbearance with all of this, and please continue to stick with it. I'll move now straight to questions, and the first question today comes from Steve Brown from STV.
Good afternoon. I just wondered, given the increased pressure on the NHS that we've seen in the last 24 hours, Health Board's coming out and talking about non-urgent operations having to be cancelled, whether you've given more consideration about the self-isolation rules of NHS staff who've been double vaccinated. And also you say that England has often the exception. Can we read into that England will also be the exception when it comes to double vaccinated people being able to forgo self-isolation from amber countries as well?
Thanks, Steve. I'll take those questions in turn. Obviously, they're related, but they are separate. On the issue of self-isolation for close contacts of positive cases, I said in my remarks that we are currently reviewing that policy and will set out our intentions on that soon, and I may say more about this in my statement to Parliament next week. And you're right to say that within that consideration, obviously we're considering it in general terms, but we are also considering it in relation to particular occupations and workplaces where having large numbers of people self-isolate potentially raises questions about sustainability of services. It's really important that we don't take unnecessary risks with the health and well-being of people in these occupations. So that's why we need to be careful. And obviously, health and care staff fall into that category. So we'll set out more around our thinking on that soon, and perhaps as soon as my statement next week. On the issue which flows from the statement that's just been made by the UK Transport Secretary in the last hour or so, changing the position on the quarantine requirement for people, UK citizens, as I understand it, returning from amber countries, if they are double vaccinated, no longer having to isolate. Again, we are considering that carefully. We'll look carefully at the statement that's been made in the UK, and we'll come to a decision on that fairly soon in terms of whether or not that will apply to people returning to Scotland. We do really want to use vaccination to the maximum in terms of allowing it to open things up that previously would not have been able to be opened up. So I'm not ruling anything out on that front. But clearly we are at a fragile point in our pathway out of this. So we also just want to be careful that in our understandable desire to get to the end point as quickly as possible, we're not actually making it harder for us to do so. We're considering all of this carefully, and I know that can be really frustrating. People just want answers now. But actually sometimes taking a bit of time, monitoring the data, working out exactly what is sensible and not to do helps us get to the right position more quickly. So I'll have more to say, no doubt, on all of these things to Parliament on Tuesday.
I think it's right that we consider all aspects of risk when we're talking about double vaccinated health and social care workers who have been asked to isolate, working in a service that at times is under pressure. The UK CMOs have been considering this just now, and we've been working along with other senior clinicians across the UK and our public health agencies, Public Health Scotland and Public Health England, to look at the evidence and the approaches that what the evidence tells us is the right and the safe thing to do here. Whilst the public health agencies are gathering that information just now, we will consider that and then make any changes that are necessary following that.
David Shanks from BBC.
Good afternoon, First Minister. We spoke briefly about hospitals. Hospitals in Highland and Grampian declaring code black. NHS Lanarkshire also reporting pressure on services. What level of hospitalisation or deaths is the government willing to accept whilst continuing with unlocking, or could there be an imposition of further restrictions or restrictions kept? And secondly, if I may, you mentioned travel restrictions, but there are still big decisions to be made on self-isolation and school bubbles when the holidays are over. When should people expect answers on that? Also in the statement next week?
On the first part of your question, can I just be clear? I don't accept as inevitable any number of deaths or hospitalisations. I can't bring myself, no matter how sort of clinical these discussions often have to be. I can't quite bring myself ever to say, yeah, we'll accept a certain level of deaths or hospitalisations. We want to minimise the impact of this virus in all ways, which is why, even although vaccines will get us to a much, much better position, hopefully very soon, we've got to be careful about the path we take between now and then, because I want to get to that end point I certainly want to get to that end point, but I'd like to get to that end point with as few people falling ill from this virus as possible, and certainly as few people dying from this virus as possible. So I don't like talking about, you know, a certain level of human life is somehow acceptable, because it's not. On hospital impact, though, and you know, we've been saying this all along, one of the really positive things about the vaccine impact is that weakening. It's not broken, and I think we should be very clear that it's not broken, but a significant weakening of the link between cases and people ending up so ill that they need hospital care. But again, it's a basic issue of arithmetic. If it's 3%, say, you know, we hope it might even get lower than that, but say it's around 3% of all cases end up in hospital. If you have 300 cases a day, that's one thing. If you've got 3,000 cases a day, that 3% is still going to put enormous pressure on the health service, particularly when the health service is much busier again doing, as we want it to be, non-COVID care. So we have to be very mindful of that impact. We can't just ignore that. So it is a key consideration in our thinking as we go forward. And lastly, and it is really good that young people are far less likely to become ill from this virus. But again, we cannot just experiment with our young people. Young people are suffering from long COVID. We feel as if we've been living with COVID forever, but it's still a relatively new virus in the scheme of things. And it's not been around long enough for the experts to really understand how long is long COVID and what are the long-term implications of that. So again, we just need to be cautious. It is human life we are considering here, and for people like me, the weight of that responsibility should always feel very heavy in what we are doing and how we're navigating our way through this. And I think, while I understand the impetus behind it, talking about, you know, Freedom Day and it's all going to be over, we all want that. But if that leads us to just pretend that the risks have disappeared, we're going to have a lot more illness and a lot more people dying than is strictly necessary. And I don't think anybody should be glib about that. On the point about self-isolation, generally, amber country quarantine and school bubbles, I will set out, no doubt, some more thinking around all of this on Tuesday. With schools, it may not be the final decision on every aspect of that, because again, we need to think through all of this carefully, we need to monitor the data. But certainly before schools go back, we will give absolute clarity on what the position there will be. I will try to do, as I've tried to do all along, is step by step take us through these things. And sometimes, and it is not easy, and it gets harder the longer we go into this, sometimes that means saying, you know, why we're taking a bit longer before coming to a decision, just so that we're trying to give ourselves the best chance of getting a decision right. And actually, today's case numbers, or the case numbers over the last 7 days showing a slowing down, actually proves the merit of doing that. There was calls for the Scottish Government to say at the start of this week whether or not we were going ahead with the July the 19th move. If we'd taken that decision at the start of this week, it may have been a less positive decision than I hope we might be able to make next week, because we're taking time to see what's happening with the data. So I know that can be frustrating, but it is, I think, the right way to approach this, given the unpredictability of the situation we still are dealing with.
What we're seeing across the country just now is well-established measures being undertaken to cope with the additional demand that's coming into particularly the hospital system. But it would be a mistake to think that this is just the hospitals who are experiencing this additional pressure, because our community-based healthcare services, our public health teams are seeing this additional activity as well. It would also be a mistake to think that this is purely due to the rise in COVID cases that we've seen, because when I speak to my colleagues around the country, what they're telling me is that a lot of the activity they're seeing in hospitals just now is for other reasons as well. Now, the rise in COVID cases is contributing to that, and we're seeing a small rise now in the hospital-based cases with COVID-19 as well. But what I'm hearing from my colleagues is that although they're exceptionally busy, using these well-established measures, that they're coping with this extra intake just now. And I'm encouraged by some of the signs that we're seeing in the overall case rate. When I look at the case rate over the course of the last 7 days, we've seen a reduction in the absolute numbers of positive cases that we've seen. We've seen that go from 21,746 down to 20,993, so a slight downturn there. And in the 7-day cumulative instance, we're also starting to see that things are plateauing out with a slight decrease on the last figures that we have as well. I actually expect, barring any shocks over the next couple of days, that will continue to decrease a little bit further as well. The patients that we're seeing coming into the system just now are patients who became ill during that real spike that we had a week to 10 days ago, and that are now translating through to requiring additional forms of treatment in hospital. And I would hope that with the slight reduction we're seeing with cases now, that we'll hopefully see that gradually plateau and reduce as well.
Simeon Brown from Channel 4 News.
Hi. You've been more cautious to follow Westminster's announcement today. What guidance are you following that Westminster isn't? And have you appealed to Number 10 to ensure greater uniformity between England and Scotland?
Look, I can only take the decisions that fall to me to take for Scotland. It is for the Prime Minister to decide what he thinks is right for England and explain the rationale for the decisions he's taken. I think it is important not to try to second guess each other. There are lots of decisions that, and travel is a good example of this, where it's very difficult for Scotland to take a completely separate view because we're impacted by the decisions that are taken elsewhere. And obviously, one of the considerations and at times frustrations is that much of the media coverage or the domination of the media coverage around what is happening in England can be confusing for people in other parts of the UK. But I can only continue to take the decisions I'm taking here for Scotland. I take those decisions with very good advice from Gregor, from Jason Leach, from our wider clinical teams, and from teams across the Scottish Government about the impact of the decisions we take to try to tackle COVID on other parts of life here in Scotland and come to balanced judgments. The decisions ultimately are mine. I'm accountable for them. I'm responsible for them. And that includes when I get them right and when I get them wrong. And that's the nature of the job. What I do know is that we've seen a hopefully now plateauing situation in Scotland, but a steeply rising infection curve in Scotland in the last few weeks. And this has been different for Scotland. In previous waves of the pandemic, we've been what I would describe as behind and below the curve elsewhere on the same general pattern, but behind and below. Delta seeded into Glasgow quite early, and therefore we've been ahead and above the curve in this wave. And that's been not comfortable because in some respects we are having to see what happens when you've got a rising trend of infection with a increasingly vaccinated population, and much of the rest of the world will be looking at what we do. So that's difficult, but it's not unique. If I look in cases in England now, that sharp rise you can start to see in England. I think we've got to be very careful, particularly so close to the vaccination-induced endpoint of this. We've got to be really careful that we don't end up accepting a higher than necessary burden of illness, a higher than necessary burden of deaths, and pressure on our health service that won't just be felt by those working on the front line, but by people needing non-COVID care. And I think it's particularly important, while we all are very, very relieved that young people seem to be less affected by this virus, I don't think we can just experiment with our young people, because we know the impact of long COVID is there. So what that says to me, as has been, I suppose, the watchword all along, is be cautious about this. It's human lives we're dealing with here, so be cautious. We know we're getting closer to the end point thanks to vaccines, but let's try and get there as safely as we possibly can. And that's how I'm going to try to navigate this, hopefully, final phase. And I know that won't make me popular with everyone, but my job is not always, I'm a politician, of course you like it when you're popular rather than unpopular, but my job, and I've never been as acutely aware of this as I am during this pandemic, is to take the decisions I think are right, not the ones that will necessarily make me most popular. Gregor, do you want to add anything there?
I think the only thing I would add to that is we've learned an awful lot about COVID-19 over the last 16 months as we've come to grips with it. But it would be really arrogant of us to think that we've learned everything, and I think that there's still one or two things that we need to make sure we've properly explored with the effects of COVID-19 before we abandon that sense of caution. And in fact, if you listen to just WHO in the last 24 to 48 hours, again, they're emphasising that need for caution on a global scale, just to make sure that as countries, even countries like ours with one of the fastest vaccination programmes anywhere in the world, are just showing that extra element of caution as we begin to exit the restrictions that we've all had to endure over the last 16 months.
McDonald from Global.
Thank you, First Minister. Focus just now is obviously on the move to level zero, or the scheduled move to level zero on the 19th. But of course, we're expected to move out of the level system on the 9th of August. Are we still on track to meet that date just now, given the pressure that we're seeing growing on hospitals?
I hope so. And if, for reasons I've set out many times before, I think it's important that we don't jump a step. So we've got a decision to take for the 19th of July. It's important that we get that right, because frankly, getting that right makes it more likely that we will be on track for the decision on the 9th of August. So it's really important to take this step by step. As I said in my statement, I'm more optimistic about next week than I might have been this time last week, because we think we're seeing, and I can't say this definitively because tomorrow's numbers might prove me completely wrong, but we think on the 7-day averages we're seeing a slowing down of the rate of increase in Scotland. So that gives me a bit more optimism, but I want to look carefully at tomorrow's data, Saturday's data, Sunday's data, Monday's data before making that final decision on Tuesday. If we do see that and we go to level zero, what we have learned, and Gregor might want to say more about this, what we have learned, one of the things we've learned during this pandemic is any easing up will lead to cases rising again. And so we should expect the move to level zero to see things tick up again, because that's how viruses work. And then we'll want to make sure that plateaus and doesn't go too far to give us the confidence we can get to where we need to be for the 9th of August. So I hope we're on track for all of that, but I can't say that with 100% certainty. Just in the same way I've not been able to predict anything in the future with 100% certainty throughout this. But what I do know is if we all get vaccinated, if we all keep being sensible in the interim, then our chances of all of this going ahead as scheduled increases.
The levels of population immunity that we have are increasing every day, partly as a result of the vaccination programme, partly as a result of people coming into contact with infection. And with every rise in population immunity that we have, things become less likely that we'll see the scales of spikes of infection that we've had in the past. However, the First Minister is absolutely correct. As we begin to open up society, as we begin to create more opportunities for people to come together, there is more risk that we'll start to see a rise in cases again. And we've just got to do this in a very cautious way to make sure that as we begin to open up, as we begin to come together, live our lives as normally as is possible, then we don't shock the system in a way that sees those infections really begin to spike again. And I think it's that really compromise between the desire to make sure we get back to normality as quickly as possible, which I feel just the same as everyone else, with making sure we do that in the most cautious way possible so that we don't precipitate a real crash in cases.
Callum Clark from Borough.
Good afternoon, First Minister. I'd like to get your thoughts on the Lancet report, the group of scientists that have been critical of the UK government's plan for easing restrictions. The report states that any strategy which tolerates high levels of infection is both unethical and illogical. Now, I know we're moving at a slightly slower pace in Scotland, but if we were to go ahead with the July 19 date and the August the 9th date for completely ending legal restrictions, COVID restrictions that is, with the high cases that we have, with the strain on hospitals, could that not also be seen as tolerating high levels of infection?
Forgive me, Callum, I've not read the Lancet report in detail, though I have seen some of the reportage around it, so I know the thrust of it. And I think if you listen to what I'm saying today, it probably is not a million miles away from what the advice in that report is, which is, look, we have to make a transition back to normality. We can't live our lives under restrictions forever, because not just because that has an impact on the economy, although it does, and that then has an impact on the rest of us, but it has an impact on our health in other ways, mental health and physical health, if the health service is then having to deal with a rise in COVID cases and delay other procedures. So we have to transition back to normality. We're in that transition. The question is, how do we do that at a pace that is as safe as possible and mitigates the risks of opening up as much as possible? And, without having read the detail of it, what I do agree with is that we think case numbers are less of the absolute driver of our decisions than they were pre-vaccine, because vaccines are reducing the risk of people with COVID becoming seriously ill, but it's not taking it away completely. So we can't just say it doesn't matter how many cases we have, because within those cases, there will be a lot of people who become very ill. There'll be a lot of people, including younger people, who don't become so acutely ill that they need hospital care, but might have long COVID. And again, we don't know. Standing here right now, we don't know what the impact of long COVID on somebody is going to be a year from now or 2 years from now. So again, we've got to be cautious. And yes, we've got to be cautious about the pressure on our health service, because we don't want a COVID national health service. We want a national health service that's capable of treating people no matter their illness. So that means that while, yes, we hope, and our last strategic update set this out, we hope that we can be less sensitive to just case numbers, but we're not yet at the stage where we can completely ignore case numbers either. We need to see them come down from the levels they're at right now, and that's why these decisions have to continue to be taken carefully and cautiously. And I understand that for a lot of people listening to this, a lot of people just wanting to get back to their lives. That means everything I'm saying right now, you'll be screaming at your television and sort of hating me for saying it. But my job is to try to complete this journey as safely as possible, and that's what I'm going to try to do. Tom Eden from PA.
Thanks, Westminster. Good afternoon to you both. You said yesterday that the current situation, sort of the number and trajectory of cases, is below the worst case scenario, the scenario that you'd modelled. Yet the test and protect system is clearly under pressure and struggling. So if you'd forecast that infections could be at this level or higher, why was the contact tracing system not prepared and able to cope with the numbers that we're seeing now?
I think, with the greatest respect, Tom, I think you're understandably sort of mischaracterising what the purpose of these models are. We don't model a worst case scenario and then say, well, we've got to sort of accept that that is what we're going to be dealing with. Every worst case scenario we've had, we want to make sure we don't get to that, because it is significantly worse than anybody would want to contemplate. And we try to make sure that our systems are capable of dealing with what is a sort of most likely scenario, because we are unlikely to ever want to allow things to get to the worst case scenario, purely because that would lead to many, many more people dying than anybody should be comfortable with. On Test and Protect has been operating really well, and it is still operating well, but it's always going to be under pressure when cases rise, because the volume of work that it is doing increases, and we flex the resource there to cope with that. And over the last week in particular, as case numbers went up, it came under particular pressure, and some other changes have been made that allow it to be more productive and efficient, but also lead to people being contacted more quickly. So the use of digital forms, the use of text messaging more often. So that is part of how we prepare the systems to cope with the demand on them. But the most important thing we can do to allow Test and Protect, or our healthcare system more widely, to cope is to get case numbers down, which is why if I ever find myself just looking at a worst case scenario line on a model and saying, okay, we'll just plan to face that, then I won't be doing my job properly, because everything we do should be trying to stop us ever reaching that worst case scenario. So I think it's important that we just understand what the point of and the purpose of modelling is. And my final point here is, while we can't be definitive about this, I hope that recent days' numbers are starting to show that slowing down of the situation we've had in recent weeks, and that not immediately because of the time lags involved with this virus, but over the next week or couple of weeks, that should also lead to an easing of pressure from COVID on our healthcare systems. And these are the things, obviously, we monitor really closely day by day. Dan Vevers from The Sun.
Thank you, First Minister. I just want to follow up on Tom's question about Test and Protect, because last week you said the system was coping well because it was continuing to meet a World Health Organization target of closing 80% of cases within 72 hours. But yesterday's Public Health Scotland report actually showed this had not been the case over the past fortnight. Are there plans to increase resources and staff to help the system get on top of the situation faster, especially if you're wrong and cases do go up again?
I'm sure you've been paying close attention to what has been happening through Test and Protect in the last few days, Dan, and what I've just said there. So what I said last week was correct, that it had been coping. There was a period of days which was reflected in yesterday's figures where clearly that pressure was much greater and the contact times fell below where we want them to be. But that is why there were... So yes, we are, particularly through the National Contact Training Centre, Contact Tracing Centre, increasing staff resources, but also modifying the approaches that Test and Protect is taking to contact tracing to allow it to get through more cases and people to be contacted more quickly. So we're not standing back. We are on an ongoing basis making changes, and I think over the last few days the performance of Test and Protect has started to go up again as in line with these changes. But this is something that requires us to monitor and flex and change on a day-by-day basis if necessary. Rachel Watson from the Daily Mail.
Thank you, First Minister. I just want to go back on Test and Protect again. And Dan mentioned the WHO target. Are you concerned that if you're not meeting that not getting to all those cases could risk further spread of the virus? And at the weekend, it was claimed that people are now less willing to comply with the system. And is that a concern for you as well?
So on the first point, we want to meet that WHO standard. I've deliberately quoted it often, and so it's not. It wouldn't be right for me to sort of suddenly, because we have a week where Test and Protect doesn't meet that, to suddenly say that's not important. It is important, and that's why we've made the changes and will continue to flex resource so that we are supporting Test and Protect to meet that target, and I hope it will get back to that in the days to come. On the second part of your question, as we get further into this, the burden, and I use that word deliberately, that we put on people who are identified as close contacts to self-isolate for 10 days gets greater and greater, both in terms of individuals, if maybe they've been asked to do that more than once, and collectively, if case numbers are higher, the number of contacts of case numbers is going to be higher. So that starts to impact on businesses and such like. And, yes, I'm not hugely concerned at the moment that we're in this position, but we need to be careful that we're not seeing compliance with the isolation part of this reduce as people find it more difficult, and therefore the effectiveness of that reduces. So that is why we're reviewing that policy for the future. Does vaccination allow us now to take a different approach, not to positive cases and not to people with symptoms, but to close contacts who are not symptomatic? Does vaccination and testing allow us to reduce the burden of self-isolation? That is actively under consideration, and I will say more about that shortly. But that is, I think, recognising that as we go through this, we have to recognise the impact on people, the impact on businesses, and making sure that the approaches we're taking are being effective in practice. And, given where we are with vaccination, we're also able, I think, to think about possibly having different approaches than we were able to have before we had the vaccine. Do you want to add anything?
So a couple of points I would maybe make just now, and it's probably worth just referring to the WHO guidance on contact tracing and actually how you implement escalation procedures within national contact tracing approaches, because those of us who've been working within public health for years will recognise that at certain levels of community transmission, contact tracing begins to have less utility, and you need to make changes. Now, the WHO guidance recognises this, and it shows an escalation framework whereby you begin to take different approaches as different levels of cases are seen within the community, and that's exactly the process we've been going through in Scotland just now in terms of actually changing the way that these contact tracing teams work. And at this point, I just want to pay tribute to everyone working in Test and Protect and health protection teams across the country for the way that they have coped with this increase in cases over this last while, because the way that they've responded by making these changes, following the kind of guidance that WHO have put in place and making sure that they then respond in a way that, again, improves the performance of the Test and Protect that they're doing just now is something we should all be very grateful for. In the future, with the so many of the population having been vaccinated, it's right that we begin to consider what different approaches might be for the future. And there are currently pilots which are examining the role of, for instance, daily contact testing to see how that might begin to be offer an alternative for people who have been asked to isolate in the past. All of these will, once we've got results from those, will be fully considered and taken into consideration as to how we get to this next stage.
From the record.
Good afternoon, First Minister. If I could ask, firstly, if you can have any idea of the percentage of patients who are currently in hospital and ICU who haven't been vaccinated at all. And also, with regard to August 9th, it's generally accepted that all rules will go then, but will that include the compulsory wearing of masks on places like public transport and in shops? Because surely that it's more likely to lead to an increase in transmission.
Thanks. On the first part of your question, I don't have the current figures in front of me about the vaccination status of people in hospital. Public Health Scotland have been publishing that on a regular basis, so we'll get that to you, the up-to-date form of that to you if we can later today. On the second part of your question, I indicated this when I set out the 9th of August as our hoped-for date for lifting the remaining major legal restrictions, that I think after that it is still probable that we will require the wearing of face coverings in certain settings, public transport perhaps, retail perhaps other settings as well. So while I'm not going to be absolutely definitive ahead of making the actual decision, I do want to be clear. I think the wearing of face coverings for a period longer is likely to be one of the not enjoyable and at times really irritating things that we have to do, but nevertheless quite basic mitigations that help us to protect each other. And just to go back to what we used to say all the time when we were introducing the requirement for face coverings, if you wear a face covering, however much you may hate doing it, you are helping protect somebody else. If you happen to have the virus, you're reducing the risk that you pass it to somebody else. And if somebody else is wearing a face covering, they're helping to protect you in the same way. Now, I know all of us desperately want to get back to the stage where we don't have to wear face coverings, but if you're asking me, and I'm going to speak personally here, and some people will disagree with this, some people will agree with it, but if you're saying to me that we can live free of most of the restrictions that we have been living under and are still living under, but one of the things we have to do to get that is to wear face coverings in certain circumstances, then my personal view is that would be a price worth paying to be able to do more of the things that we all enjoy doing in life and doing them in a way that reduces the risk to other people. So I don't want to give any suggestion here that the ending of the requirement for face coverings, at least in some settings, is coming anytime really soon in Scotland, because I think that possibly would be giving people the wrong idea.
I think as we begin to move out of the remaining restrictions that are in place, it's that gradual process can be eased by looking at some of the very simple measures we can take that again reduce the risk of transmission. And there's for me a kind of collective social responsibility in wearing face coverings because of the benefit that it produces to others. And certainly as we consider this next period, I would think that for myself, a personal choice, I would be still continuing to wear face masks where I felt that there were lots of people around and where people perhaps felt it would make them more comfortable if I was wearing a face covering as well. So from that perspective, I think it's that benefit that it has to others which we must recognise as part of the ongoing process of wearing face coverings for a little while yet.
Thanks. Simon Johnson from The Telegraph.
Thank you, First Minister. You mentioned in your opening remarks that both face coverings and physical distancing could be around for some time yet. I just wanted to get clarity on whether the intention is to end social distancing still on outdoors on July the 19th and indoors on August the 9th. Secondly, a key part of the Prime Minister's rationale for his timetable, he said in his statement to the Commons, was basically that these things are much easier to do in the summer than in the autumn and winter months when the virus has more of an advantage, people are indoors, etc. And that if we don't do it now, essentially, we might have to wait till next year. Is there a sort of time pressure created to basically get as much of this done as possible before the weather turns in September? Thank you.
On the first point, we set out for the 19th of July the removal of physical distancing outdoors. It would be 1 metre indoors, and then 9th of August the removal of physical distancing. I will set out next week for the 19th of July whether we are going ahead with that, but that is the extant position. But the point I'm wanting to make is, unlike England, even if we go ahead 100% with what we'd set out for the 19th of July, that's not the complete removal of physical distancing at this stage. And I think that's important to stress. On the time pressures, Gregor might want to say more about this from a much more educated position than me. I'm not sure that's how the virus works. If we just can open up everything now, we give people a bit of, well, is it how the virus works? I'm not sure it's the right thing to do, is to say, well, let's open up now because it's coming back with a vengeance in the winter and we're going to have to close everything down again. Now, I'm paraphrasing there. I'm not suggesting that's exactly what Boris Johnson said. I want us to try and keep as steady a path forward as we can, recognising that at times we might not be able to go as fast as we had hoped. At times, maybe we'll even have to take a step backwards. But broadly speaking, our trajectory is forward. Can I guarantee that? No, for all the reasons we've set out. But this idea that, well, let's just open up now because we're going to have to shut down again in the winter, I don't think that is the right, I don't feel that's the right rationale to apply to this. By the winter, we'll have all adults double vaccinated. We'll probably be doing booster vaccines. You know, who knows yet what we'll be doing with younger people. So I'd like to try just to keep us moving. So for me, in summary, that means trying to do things now at the right pace, rather than at a pace now that is almost predicated on things getting really bad again later in the year.
Joe, we've got to go at the pace which is right for the epidemiology that we have just now. And although all of us would maybe think that there's an ideal kind of pathway to follow in what lies ahead, we've got to be governed by our current experience of particular case numbers and how that's then impacting on people across the country. When we're considering any infectious pathogen like this and people coming back together, as I've already said, we know that just the very fact that people are going to have the opportunity to interact again might lead to an increase in cases. So we've got to factor that into our thinking as people begin to kind of lose the restrictions around about them, come back together, make contact with others as well. So we're likely to see an increase in cases. And there is a balance to make sure that if we see that increase in cases, then it doesn't coincide at a time when, with anything which will amplify the number of cases that we see, or something which I think is perhaps even more important, that it doesn't coincide with other infectious agents that are about at the time as well. So we're cautiously looking in the future, constantly surveilling to make sure that we're seeing where there might be signs of other respiratory infections such as RSV or flu when they're predicted to come in the season as well. And it's a balance between what we know of the current epidemiology of infections just now, what might lie ahead of us in the future, and charting a path that's the safest path at the time, and with the kind of gradual moves that make sure that we don't have a rise in cases that causes extreme problems either to society or to health and social care services as well.
Muir from the Financial Times.
Thank you, First Minister. Are you concerned at all that the UK government's moves on July 19th will have an effect on behaviour of the public in Scotland? Do you worry that this Freedom Day will make people less cautious in their own actions here?
Yeah, that's always been a worry, that if we are for, again, I'm not being pejorative about this, if for reasons that different governments are happy to justify, if we are going at different paces and doing things in a slightly different order, then again, this is not a pejorative statement in any way. The sheer domination often of the coverage from England into Scotland in a media sense can confuse the messaging here and perhaps give people the idea that things are being advised that are not being advised. So, that's one of us, by no means the only reason and by no means the most important reason, but at an earlier stage in this pandemic when we were doing these briefings on a daily basis, one of the reasons was just to try to make sure that there was a constant, regular sort of source of the advice that was extant in Scotland at any particular point. And again, it's why I'm taking the time today to just remind people that we have a planned change on the 19th of July, which we'll set out next week if and to what extent that's going ahead. But assuming it goes ahead, that change on the 19th of July is not the same change as is being made in England on the 19th of July, which is a complete lifting of everything. So obviously you'll hear a lot from us to try to just remind people that on the 19th of July, it will still be required to wear face coverings in Scotland, even if it's not in England. But, the nature of media coverage means that it's not always straightforward to get those messages clear and understood, but we'll do our very best. Jane Bradley from The Scotsman.
Thank you, First Minister. You've obviously said that you're not going to follow in Grant Shapps' footsteps in terms of allowing double vaccinated people from amber list countries in, but are you concerned that in that case people may sort of get around the situation by flying into, say, the north of England and travelling up to Scotland? And also, secondly, the Scottish Passenger Agents Associations today has asked for sort of urgent action over an app showing vaccine status for people who want to travel or need to travel. What's happening with that in Scotland at the moment?
So, firstly, Jane, can I just be very, very clear here so that there's no misunderstanding? I did not say that we weren't following suit there, nor did I say we were. What I said is we haven't taken the decision, and we will take that decision over the next days, and I will set out, as part of my statement on Tuesday next week, where we are with that. So to say I said today we were not doing that would not be accurate, and I just think it's important to be clear. We've not taken the decision, which is a different thing. The app, we are working on the digital solution to people being able to get their vaccine their vaccine status for the purposes of essential travel. That's not yet at the point of being introduced. We'll update on that shortly, but in the meantime you can get your vaccine certification if you need to travel through the way that we've set out before, where you can order it and it gets sent to you in the post. Helen McCardle from The Herald.
Yet for the app, do you know yet?
It will be relatively soon, but I'm not going to give you a date at the moment because I don't have that at the moment. Helen McCardle from The Herald.
Hello, afternoon, First Minister. I just wanted to ask, when we had the briefing, I think last Tuesday, there was a suggestion that a decision from the JCVI on vaccinating children might be imminent. We still haven't had one yet, and I know that there is some concern among scientists that perhaps the policy being adopted across the UK is just to allow children to acquire the infection naturally. And there's also concerns that if we don't vaccinate people under 18 more routinely, then reaching herd immunity is going to be close to impossible. So I just want you to get what's your understanding of the situation at the moment and what might happen?
I'll As you will have heard me say many times before, I put great store on issues like vaccination, on following the clinical advice, because I don't think it is right for somebody like me with no clinical qualifications to second guess that. But if I, just from a non-clinical perspective, I don't take the view that we should just, a bit like I said earlier on about young people, I don't take the view that we should just blithely let kids or young people more generally get infected and not care about the consequences, even although we do know that the risks to children are much, 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 much lower from COVID than for older people. But we shouldn't be complacent about any human individual's health. And I suppose from a non-clinical perspective, I want to see this vaccine reach at the extent of vaccination reach as far as possible. And as long as the risk-benefit ratio is right, then if it's possible to do, I want to see young people get the opportunity for vaccination as well, because I want to see young people protected as much as possible. But I need to have the clinical advice as to whether that is a clinically appropriate thing to do. And I hope that we have that advice sooner rather than later.
Helen, the JCVI have had many meetings on this subject, and they've rightly so, I think, considered all the evidence around about this very carefully. I heard the Secretary of State give an interview in the last day or two where he suggested that he had received some advice from JCVI in relation to this and was currently considering it. But I'm afraid that at this point in time, I don't know at what point that will be released at all.
Libby Brooks from The Guardian.
Thank you. The head of BMA Scotland was saying yesterday that really a decision was needed within the next few days on how to stop health services becoming completely overwhelmed. And if we're waiting for this decision on changing self-isolation advice for healthcare staff, should hospitals be considering other measures in the meantime, like suspension of non-essential surgery, for example? And specifically for the CMO, you were saying earlier that you thought that there were other factors involved in why there's so much pressure on services at the moment, not just coronavirus. Could you tell us what those are, please?
I'll hand over to Gregor pretty quickly on this. Just very briefly from me, we are considering the issue of self-isolation generally, but in terms of health and social care workers in particular, as a matter of urgency, and I hope we'll be able to say more about that soon. And I think Gregor's already alluded today to work that's been done between the 4 CMOs across the UK. On the other things that the health service has to do, literally on a day-by-day basis, to make sure it can meet the demands being placed on it. We are in contact with every health board, literally on a daily basis, helping to support them in the decisions that they make. And, it is not something that is unheard of. We don't want it to happen, but in normal times, that for a brief period of time, a particular hospital would pull back on elective care if there was for whatever reason, a surge in non-elective unscheduled demand. So these are decisions that we do our best to support health boards with on a daily basis. But the more we can get case numbers down right now, the more we will reduce the COVID pressure on the health service, and that is a real priority.
Libby, I think there's a variety of reasons as to why we're seeing such high levels of activity within the hospitals just now. So part of that is about the remobilisation of the health service and trying to see people and get them into hospital for procedures that have been delayed as a consequence of the response to COVID-19. That's just a small part of it. But what I'm hearing from colleagues is that they are seeing much more in the way of very complex and often quite unwell people who are presenting, particularly either in community-based services or at emergency departments, with illness which is necessitating admission to hospital, and where sometimes the length of stay is slightly longer than we would have had in the past as well. So it's ill people within the system for a variety of different reasons. There's no one cause of that by itself, but we're also seeing increased respiratory infections around about the system as well, particularly in younger children as well, where we know that we have an upsurge in para-influenza, which is a type of viral infection, and that's having a knock-on effect with people presenting both to GPs and to emergency departments with kind of unwell children as a consequence of that as well.
And lastly today, Rebecca Monroe from Broadcasting Scotland.
Good afternoon, First Minister. So, going by recent media coverage, you could be excused for thinking that the Scottish Government has completely failed in their handling of the COVID crisis. However, given that the current increase in numbers are starting to plateau, do you think that the criticism of the work done by you and your colleagues is entirely fair?
Oh, as a politician who's also a human being, human nature means you never think criticisms of you are entirely fair all the time. But you know, it comes with the territory. I'm the First Minister leading a government that in normal times takes big decisions that impact on people's lives, but particularly right now are taking decisions every day that have massive impact on people's life. It is right and proper that we are scrutinised, criticised where that is appropriate, and you know, it comes with the territory that sometimes you'll get criticised in ways that you don't think is appropriate. But you know, democracy demands, particularly right now, that there is really robust scrutiny of government. And I'm not saying I always enjoy it, but I certainly don't shy away from it. So I don't really have anything further to say about that. My focus really is just on trying to do everything. Whether it's always popular or not is neither here nor there. We've got to do everything to get cases coming down so that we reduce all of the pressure and keep ourselves on the track back to normality, which we all want to see more than anything else. Thank you all very much. That concludes the questions today, and thanks to the journalists. Thank you to Rachel for our BSL interpretation, to Gregor for helping me with the questions and explaining our current situation, and thanks to all of you for everything you continue to do to help us get through this. Please get vaccinated, test yourself, and follow all of the basic but really important public health measures to try to get through this difficult period so that we can stay on track to the return to normality that all of us desperately crave. Thank you very much, and I will see all of you for the statement next Tuesday in Parliament, if not before, for an update here. Thanks very much for now.